Hi, Dr. Pelto here. I'm going to answer a question that a patient recently asked. How well does shockwave therapy assist with chronic heel pain? Let me explain first of all what shockwave is, and then I'll talk about chronic heel pain. Shockwave is a treatment that's used to break up the thickness in the areas that are inflamed, chronically inflamed. Shockwave is the same technology that they used to use when patients had kidney stones and they put them in water and they were shooting sound waves at them to break up the kidney stones. In a similar manner, we use shockwave with a special gel, an ultrasound gel, on the skin, and we hit the area where the fascia is inflamed. We can also use this on other areas that are ligaments, that are tendons, and it's very, very helpful if something is chronic. The key here is chronic. If it's acute, many times we can put a patient in a walking boot, we can help them to rest it, take anti-inflammatories, icing, and it can make it feel better. But when does a heel pain become more chronic? Chronic heel pain, the main attribute is thickening of the fascia. I'd like to explain this. If you look here, this is a picture of the right plantar fascia, how in the foot's upside down. So this is the heel, and this is the fascia. You can see that the color right here is similar to the rest of the foot. This is the skin on the top, the skin and the fascia, similar color. That's the distance between A and A. Here is the example of the left fascia. You can see that it is a thicker fascia, the distance between the two A's, and you can see that it's a darker color. It's closer to the color of the bone right here, and it's not like this one over here. The bone, it doesn't reflect any of the sound waves, whereas this has a harder time reflecting the sound waves. That's why it's a darker color. This is called plantar fasciosis, which is a chronic inflammation of the fascia. The problem with chronic heel pain, or fasciitis or fasciosis, the chronic, it doesn't have the best blood supply. Therefore, what happens with the fascia is it gets thicker instead of healing. It gets thicker and thicker. That's where the shock wave can be very beneficial. By using sound waves, it hits the area and it actually brings a whole healing cascade of a lot of information. I'm going to put a couple of videos here that you can look at where we're going to go specifically into plantar fasciitis and also shock wave treatments for your heel pain. This is very, very effective if you've had it for many months or many years, and if you've tried cortisone injections, orthotics, physical therapy, and other treatments that didn't work. It doesn't work in everyone, but I would recommend getting an ultrasound and being evaluated for shockwave treatment. Once again, if you have your own question about plantar fasciitis, please put the question underneath this video.